Let's talk now about the coronavirus pandemic. It is surging after the New Year's holiday as the total case count in the United States stands at nearly 21 million cases. And hospitals have been strained as hospitalizations have spiked. And California has been hit particularly hard. According to the Department of Health in that state, over 20,000 people have been hospitalized, with more than 4,500 people in the ICU. I want to turn now to Dr. Dara Kass, Yahoo medical contributor, and also Columbia University Associate Professor of Emergency Medicine. Dr. Kass, always great to have you here with us. I want to start with this point of hospitalizations. I've never run a hospital before. So when I hear news like this, that it's strained, I think, of course, that it cannot be good news. So if hospitals are this strained now, right now, on January 4th, I believe is the date, what happens in 2 weeks or 3 weeks or so when we start to see those cases from the New Year's holiday really start to show up in some of these numbers?
We're prepared for across the country. With LA seeing a surge in cases and their hospitals being at capacity, in New York, we're seeing that most of our hospitals have still 30% capacity in our hospital systems. We are invoking this thing called surge and flex in New York, which means that we are hoping to look around at neighboring hospitals and neighboring systems to transfer patients as needed. What we're asking people to do is use your local resources as best as possible, which includes things like being prepared in the case of an infection in your family and using telemedicine services and other urgent care services as needed so that our hospitals stay open for the patients that need them the most. We are not going to be able to create more hospital beds than our capacity allows. And more importantly, we're not able to create new staff. So we're going to ask the community to please stop the spread of this virus and keep our hospitals open for the patients that need us the most. But I think all over the country, we're preparing for a surge of more patients over the next 4 weeks.
So what does that mean for hospitals really to be full? Does that mean, that people die, they can't get care, that doctors have to make these horrific choices, that we had heard at the start of the pandemic, they're going to have to choose who they're going, to admit to the hospital? Or is it really more that any and everywhere becomes a hospital, like the parking lot or the hallway all of a sudden becomes a section of the ICU?
So it's everything and all of the above. I think first and foremost, to use every inch of the hospital you can. And sometimes you'll see field hospitals or the Navy ships coming by to add additional beds. You'll also see creative ways to take care of patients as an outpatient. Sometimes we send patients home with oxygen or even a pulse oximeter to try to treat them at home safely and bring them back to the hospital as much as we can. We need to be able to use all of our resources as best as possible through these moments to get as many patients into the hospital. It does also mean that other patients that are not sick with coronavirus and maybe are having a heart attack or a stroke may find that their care is affected as well. And that's why we need to implore people to stop the spread of this virus, because it's not only coronavirus patients that will be affected by this.
So speaking about that vaccine distribution, there's no national or federal plan for the distribution. And right now we're way behind where we want to be for those distributions. What are your thoughts on the British model that we're seeing right now, which is get as many people to have that first shot of the vaccine and then delay that second dose, compared to what we're doing, which is, we have a list of people that are going to get the first dose and then the second dose, and then we're going to move on to the next patient who can get the first and then the second dose. What do you make of those two plans? Which would perhaps be better, especially in a country as large as ours?
So I think that we're a little bit ahead of our skis on the moving the goalpost or reshuffling our approach to this pandemic, and certainly vaccinations, when we certainly haven't maximized the approach we set out to do in the beginning. The idea of using two vaccines, as it was studied to the efficacy of 95%, has not been disproven to be incorrect. And more importantly, we haven't done it at all correctly at any state level. We're seeing that there are millions of doses of vaccine on shelves, and whether or not we choose to vaccinate just once or a half dose has nothing to do with the operational failure that it has been to get people vaccinated with the doses we have available. So what I would say is, let's not change our protocols just yet. Let's actually optimize the one that we set out to do from the beginning. And I think that that's going to take the next 16 days through the Trump administration, but also the first 100 days of the Biden administration, committing to actually putting the resources and the planning to the states to partner with them on the execution of our vaccination strategy.
I had a really quick one here for you, Dr. Kass, because I think everyone thought that with the vaccine being distributed, that it was really going to put a nail in the coffin for the pandemic. But of course, we're seeing that that's obviously not the case, especially as we need that operational plan, as you mentioned it, to vaccinate folks. So what can we reasonably expect then for 2021? If you had to take a crystal ball out for us, do you think that we could be working from home and social distancing for pretty much all of 2021 as well?
So I think that we're here, social distancing, working from home as we can until June of 2021. Really, like I said, getting the first 100 days of the Biden administration in to get their plans in place and getting through the worst of this pandemic, getting back into better weather and being outdoors again. I'm hopeful that as the spring hits into the summer, we'll have a strategy that's working for most Americans and we can get to a more normal life into the fall of 2021. But I'm reserving my judgment and optimism until the end of 2021 and looking for a more optimistic 2022 if you really want to know.
All right. Well, that's not the best news that I wanted to hear from you. Dr. Dara Kass, Yahoo Medical contributor and Columbia University Associate Professor of Emergency Medicine. Thanks always for joining us.
Thank you.